are very privileged to have you here. Now that we started this unique collaboration between the Chellaram Diabetes Institute and MUHS, what are your thoughts on integrated medicine as a field and the way forward, especially beginning with our diabetes research?
I think this is sort of just the first stepping stone. I would call these as baby steps, because with the changing disease pattern, you would know best that you'll have set up a hospital like Chellaram for diabetes, and the country is slated to become the capital of non-communicable diseases followed by cancers. We need to look at solutions beyond what is already known.
Yes.
And our idea of research is we keep researching in the same field, and there's not much happening. In all these years, except for better hypoglycemic agents or better supportive care, we haven't really changed the way we look at diabetes. And if you have to concentrate on preventing the disease or retarding the progression of the disease and reducing the target organ damage, which is actually the burden, we need to look at solutions which are outside of the box, and as I mentioned, solutions which are AFAS, affordable, feasible, acceptable and sustainable. So with that in mind, and India having an inherited knowledge systems which are probably 5,000 years old, agreed, they're not exactly evidence-based, but there's a lot which is experience-based. And with an open mind, if we approach them, because the Indian population practices pluralism. If you ask any household, and there are studies which have shown that for acute illnesses they would turn to the allopath, but when it comes to chronic ailments, most households would like to try out homeopathy, Ayurveda, naturopathy, but we've not really put it together for them. So I think that is a real potential for collaboration, for giving experience and the expertise of evidence-based medicine, bringing that to a science which is experience-based.
Yes.
And if we can combine the two and give a solution to the population, it will be very acceptable.
I completely agree with you. I think it's very important to keep an open mind and to work jointly. What would be your advice to young doctors who may be passing out in any field? It could be in allopathy, Ayurveda. How should they approach research, and how should they start doing multidisciplinary work? And would you have some messages for them?
Yeah, I think that's another very important question, because the doctors of the future are not going to be practicing the way we. I mean, we teachers were trained in the past, are teaching in the present for people who are going to practice in the future. And there's going to be a huge paradigm shift with AI, generative AI, all that coming in. What is going to bring patients to a doctor is a faith, is a relationship which goes beyond eye test. Today, the average common man is lost in the ocean of itis. I call it istitis, because he doesn't know whether he has to go to a cardiologist, a nephrologist, an endocrinologist. We don't have the holistic family practice of the yonder years, and I think this is the thing which a patient would look out to. And with AI coming in, with robotics coming in, the psychomotor and the cognitive skills would easily be kind of assisted. I wouldn't say it is artificial, it is assisted intelligence. But what will remain is the empathy. What will remain is a holistic approach. And for that, I mean, I've been a student of allopathy, but except for change your lifestyle, improve your exercise. The standard teaching in an MBBS course never really concentrated a huge amount on diet, on holistic care, well-being. So I think those are very, very important. And if a student cannot find it in his domain, he shouldn't be restricted to a degree. And he should go on to a degree plus status, which gives them an opportunity to understand. We are not asking a mixopathy where people start practicing each other's. No. We have to understand, which lets us have an insight into understanding the limitations of what I can offer. that gives my eyes to go into a collaborative and integrated practice which gives the best to the patient.
Thank you, ma'am. I think it was a pleasure to have madam and the entire MUHS team at our institution. And thank you for being with us, and we look forward to a very exciting collaborative project. Thank you everybody for listening in.